Hello, I'm Gwen Carlton. I have my doctorate in nursing practice. I'm a family nurse practitioner and I teach at the University of Tennessee in Chattanooga and practice clinically at Covenant Allergy also in Chattanooga. I'm here today at CARPS. I have been speaking on two topics. The first topic is obstructive sleep apnea. I'm pretty passionate about this topic because I think it's something that we overlook. It affects comorbid conditions, and I think it's something that we really need to make sure that we're screening for in our practices. So if you have a patient that comes in that looks tired, you need to ask that patient why they're tired. There's also a screening tool called the Epworth scale that you can have the patient fill out right in your office, and it can give you some objective data as to whether they should be evaluated or referred. One thing that's maybe a little personal, because I have obstructive sleep apnea, is that oftentimes women are not screened, that we think of it as a disease that men have, but it's also very common in postmenopausal women. So don't write off a woman and say, well, it's a woman, so she doesn't have obstructive sleep apnea, because I'm here to tell you, you can have it. One thing that I have really focused on in my practice is patients that I cannot get their asthma well controlled with conservative measures. I like to make sure that I have ruled out all the comorbidities. And one thing that I've found is a lot of my patients with asthma do have obstructive sleep apnea, and I cannot get that obstructive sleep apnea well controlled, or I can't get the asthma well controlled until I get the obstructive sleep apnea controlled. So we also know that obstructive sleep apnea can cause hypertension, it can lead to strokes, it can lead to AFib, it can lead to sudden death. So there are many, many reasons you want to make sure if you have a patient that's tired, are they just tired, or is there something underlying that condition? So that's my take on for obstructive sleep apnea.